Hello, my name is Dr. Carlo Oller. I am an emergency physician and I produce medical education videos for PatientEducation.Video. In this particular medical education video, I'm going to talk about pancreatitis. And pancreatitis comes from the word pancreas, or the organ that sits right in here in the mid-belly, close to your back, and itis for inflammation. So basically it's an inflammation or infection of the pancreas. It usually causes sudden and severe abdominal pain. People compare it to putting a frying pan to your abdomen and let it sit there. Like I said, the pancreas sits right about here in the mouth of your stomach, closer to your back, so the pain is usually epigastric with radiation straight through your back. The function of the pancreas is to produce digestive juices that help with the digestion of food and certain hormones like insulin to help bring insulin from your food into the bloodstream. Pancreatitis usually develops as a result of gallstones or heavy alcohol use. That's about 60 to 70% of all pancreatitis, but there are other causes. Most attacks of acute pancreatitis do not lead to complications, and most people recover uneventually with medical care. However, a small percentage of people have serious illness and requires intensive medical care. In all cases, it is essential to determine the underlying cause of the pancreatitis and, if possible, treat that condition in order to prevent the recurrence of the pancreatitis. As I said just before, 60 to 70% of all cases of pancreatitis occur of two kinds, related to gallstones or related to alcohol abuse. So let's talk about that. There's something called gallstone pancreatitis. The gallbladder is an organ that's like a semicircle and can sometimes form stones within it. When the stones come out and get stuck in the duct, sometimes the enzymes can back up back into the pancreas, and instead of digest food, it digests the pancreas itself, and that causes acute pancreatitis. The second type of pancreatitis, alcoholic pancreatitis. Alcohol is the most common cause of acute pancreatitis, and alcoholic pancreatitis is more common in individuals who have a long history of alcohol abuse. But there are other kinds of pancreatitis, including drug-induced pancreatitis. There's a number of prescription medication drugs that can trigger cases of pancreatitis. There is also the pancreatitis that can happen after a medical procedure. There's a procedure called an ERCP, endoscopic retrograde cholangiopancreatography. In other words, they go in to take a look at the biliary tree and the gallbladder by putting some dye up there. Sometimes when they do that, it causes some of the enzymes to back up and cause acute pancreatitis. This can happen about 3 or 5% of people who have an ERCP. There's also your genes, hereditary conditions. It can be caused because of familial hypertriglyceridemia or high blood triglyceride levels, hereditary pancreatitis or a history of pancreatitis in the family. And this condition usually occurs in children and young adults, which is kind of rare for us to see. And then there's idiopathic, or doctors are idiots and we can't figure out why you have pancreatitis. In up to 20% of people with acute pancreatitis, we can never find a cause. That means 1 in every 5 people will just say, hey, you have pancreatitis, and we don't know why. So what are the symptoms of acute pancreatitis? As I said, is severe epigastric burning pain that goes straight through your back, usually associated with nausea, vomiting, and acute illness. Most people just have the severe pain with nausea and vomiting, they get dehydrated and stuff like that. But some people get deathly ill to the point they need ICU and aggressive management. The pain of pancreatitis usually lasts days, and the pain usually relieves when the patient leans forward. Some people don't really have tenderness, and some people don't even have abdominal pain. Some can show up with reflux symptoms or burping or nausea and vomiting without the pain. In people with gallstone pancreatitis, the gallbladder pain may occur before the pancreatic pain, so therefore the pain is usually on the right upper abdomen. Gallbladder pain, referred to medically as biliary colics, occurs in the right upper part of your abdomen, extends to the back and to your right shoulder. The pain increases in intensity as it's constant, gradually gets worse, and like I said, usually associated with nausea and vomiting. In people with alcoholic pancreatitis, the symptoms of acute pancreatitis often occur 1 to 3 days after an alcohol binge or after you stop drinking. Pain is accompanied by nausea and vomiting in most people, and in severe cases, the symptoms can lead to shock or coma. So how do we diagnose acute pancreatitis? Well, sometimes it can be difficult because the signs and symptoms of pancreatitis are similar to other abdominal conditions. The diagnosis is usually based upon a good medical history, a physical exam, and the results of diagnostic tests. 2 of the following 3 are required to make the diagnosis: the typical abdominal pain, a 3-fold or more elevation in pancreatic enzyme values in blood. That means if you're allowed up to 100 or 200 of an enzyme called lipase and you have 600 or 700, it needs to be that high to diagnose pancreatitis. There's also an enzyme which we don't do so much anymore, but it's amylase, and you can do that as well. And number 3, inflammation of the gland by imaging, usually on CT scan or MRI. The number of type of tests done is tailored to the severity of the acute pancreatitis and the most likely underlying causes. Once the diagnosis of acute pancreatitis is made, additional tests are used to determine the underlying cause, like looking for pancreatitis, family history, gallstones, and things like that. Imaging tests. Imaging tests provide information about the structure of the pancreas and the ducts that drain the pancreas and the gallbladder and the tissues that surround the pancreas. Imaging studies may include an X-ray, but honestly, that's not used so much. CT scans, which is far more common, and MRI usually once you are in the inpatient, usually not in the emergency department. ERCP. ERCP is a procedure that, as we talked before, can cause pancreatitis, but it also is used to diagnose pancreatitis if you think it's caused by gallstones. So the ERCP is a procedure used to remove the stones from the bile duct if your pancreatitis is due to gallstones. So you can remove the stone, relieve the obstruction, all those enzymes start going down, and the pancreatitis or the pancreas inflammation can resolve. The goals of treatment of pancreatitis are to alleviate the pancreatic inflammation and correct the underlying cause. Treatment usually requires hospitalization at least a few days because we want to do bowel rest. So for cases of mild pancreatitis, it usually resolves with supportive care, which entails monitoring, drugs to control the pain, and lots of IV fluids for dehydration. You may not be allowed to eat anything for the first few days if you have nausea and vomiting. Usually we allow you to have some ice chips and sips of water. In moderate to severe pancreatitis, it requires more extensive monitoring and supportive care. This is because severe pancreatitis can lead to potentially life-threatening complications, including damage of the heart, lungs, and kidney. People with pancreatitis of this severity may be closely monitored in the intensive care unit or ICU. During this time, you may be given 1 or more of the following treatments. Lots of IV fluids to help prevent dehydration. Many patients with moderate to severe pancreatitis may not be able to eat in the early course of the illness. Instead, you may be fed through a tube that goes through your nose or mouth to the small intestine. If you cannot tolerate tube feedings or cannot get enough nutrients with the tube feeding, you may have to be given nutrition through an intravenous line or TPN. And you can resume eating gradually once your pain resolves, bowel function returns to normal. About 30% of people with severe acute pancreatitis develop an infection in the damaged pancreatic tissue. So antibiotic prevents the infection and controls infections already present. Acute pancreatitis is sometimes complicated by extensive damage and or infection to the pancreatic tissue. And in this case, the damaged or infected tissue may be removed in a procedure referred to as necrosectomy. A necrosectomy can be done as a minimally invasive procedure. The treatment of gallstone pancreatitis is different. In people who have gallstone pancreatitis, the treatment of pancreatitis is usually coupled with the treatment of the gallstones, which may include removing the gallstones or removing the gallbladder altogether. Gallstone pancreatitis will recur in 30 to 50% of people after initial attack of pancreatitis. So surgical removal of the gallbladder, called a cystectomy, is often recommended in the same admission in mild cases to prevent the recurrence. In people who are already old and who have serious medical problems, it may not be safe to remove the gallbladder. In this case, endoscopic retrograde cholangiopancreatography can be done to enlarge the bile duct opening. This will allow stones from the pancreas to pass and helping prevent recurrence of the acute pancreatitis. I trust this information has been helpful to you, talking about pancreatitis, its causes, its treatment, when to admit, when to send home if it's a mild pancreatitis. If you have comments, suggestions, or other questions, please post them below and I will try to get back to you. Thank you for watching. Bye-bye.